I'm Madeline Edgar, and you can buy my Self-Help Feldenkrais books at www.marvellousmovement.com. And today we're going to be talking about the pelvic floor. This is an area that has sometimes a lot of problems, both for men and women. And I taught pelvic floor exercises for many, many years, but didn't really realise that I wasn't doing it awfully well until I got into the Feldenkrais method. So it's best if you can do a long, full-length awareness through movement lesson for the pelvic floor, but even this little taste of it can just remind you what you can do during the day. So just to mention the anatomy a little bit, at the bottom of the pelvis, it's like a sheet or a hammock at the bottom of the pelvis, the pelvic floor, and it consists of several muscles all working together. And there are 3 holes in it for women, the urethra at the front, vagina in the middle, of the anus at the back, and for men there's just the front hole and the back hole. But the principle is the same. So it's a good idea if first of all you scan yourself in standing, as we've done in some of the other videos, and just notice what you're sensing about yourself today. And then tighten the pelvic floor as if you wanted to stop yourself peeing, and notice what you feel when you do that. Where do you feel muscles working? Now, for some people it will be really clear, for others it'll be a little bit vague, but often we tend to use accessory muscles like the muscles on the inside of the thighs, or the buttock muscles, or the abdominal muscles to help the pelvic floor, so to speak, but then you end up working those muscles and not the pelvic floor at all. So it's really good if we can more or less isolate the pelvic floor muscles, which do work a little bit with the lower abdominal muscles. And once you can actually feel what you're doing, it's easy to strengthen them. But many people really can't feel it. It's not an area that we are very familiar with unless you grew up squatting or sitting on the floor and using the sort of toilets that you squat over. Then you get much better control of your pelvic floor. Okay, so you scan yourself in standing again. Notice what you sense when you pull the pelvic floor up as you think of it at the moment. And do it 2 or 3 times, and be aware of even how you breathe as you do it. And I forgot to mention that you actually need a little hand towel to use during this, so I'll give you a moment to go and get the hand towel. So when you come back with your hand towel, just roll it up into so it's like a sausage, and put it on a good firm chair, a kitchen type chair, and sit astride it at the front, more or less at the front of the chair, not right to the back. And take a moment to just feel how you take the weight on your sit bones and you feel the towel in between your legs. And then again, tighten what you think of as your pelvic floor, and notice what you feel when you do it with this feedback from the hand towel. Now again, what other parts of you want to help? And do you try to do a big powerful movement? And really, the contracting of the pelvic floor is not a big powerful movement. It's quite a delicate movement. And it's easy to do if you can feel what you're doing. But if you can't really feel what you're doing, you do tend to do it too powerfully and bring in the other muscles to help. Okay. So take a breath in, and now as you breathe out, just gently close those 3 holes and lift your pelvic floor away from the towel a little bit. And then as you breathe in, just let it go down again, let it drop down. And at first you may not feel anything at all. So just be patient with yourself. So again, breathe in first, and then as you breathe out, gently close the holes, pull the pelvic floor away from the towel, and then let go and release it and feel how your pelvic floor drops down again. You may need to do it many, many times before you actually begin to thoroughly feel what you're doing. So do it a few more times, and remember to breathe out as you contract the pelvic floor. That's very important, because if you breathe in, you put too much pressure on your bladder inside. So breathing in first, and each time you want to stop the flow of the pee, draw your pelvic floor up. Close the holes, then breathe in and let them open and let your pelvic floor drop down. Okay, so this is a really good thing to practice every time you think of it, sitting in the car at the traffic lights, or wherever. And it's very good to do it in all the different positions that the body can get into. So in standing, maybe in kneeling, on all fours, lying on your side, lying on your stomach, because that gives your brain more information so that you can use your pelvic floor better in all situations. Okay, so after you've done it a few times, and if you think you then know a little bit better what you're doing, you can take the towel out, sit on the chair again, and do the same thing without the towel, and notice what you feel. And go gently. Try not to bring in those other muscles, your inside thigh muscles or your buttocks or your abdomen. Breathing in, breathing out, and gently drawing up. And the more you practice this, the stronger you get, the more control you have over your pelvic floor, which is very important, especially as you get older. Okay, so then you can come back to standing and scan yourself again, and again try pulling your pelvic floor gently up in standing, and notice again whether you're using those extra muscles. So keep it small enough not to bring in the accessory muscles, and remember to breathe out as you pull the pelvic floor up and close the holes. So good luck, and I'd love some replies on this one as to how you feel and how you did it. Bye.